Good morning, Miss Fortney. My name is Cassie. I'm going to be your student nurse from UNCW. Can I get your full name and date of birth?
It's Ashlyn Fortney. I was born on February 23rd, 2005.
Okay, I'm just going to check your wristband. All right, and then I'm going to do some hand sanitation. I'm going to give us some privacy, and I'm just going to do a full assessment checkup on you. Is that okay?
Yeah.
All right, so we're going to start with your skin. Just by looking at it, it's pink. I don't see any pallor. I don't see any cyanosis. Could you go like this? It rises with ease. Your turgor, less than 3 seconds. And then I'm actually going to feel your skin. Is that okay?
Mm-hmm.
All right. It's warm. It's moist. There's no flaking. There's no pitting. And then if I could actually look at your nails. All right. So they're round. The consistency is uniform. They're pink. They're smooth. If you could go like this for me. They're at a 160-degree angle, so there's no clubbing. All right. And if you could take off your socks for me. Thank you. So I can see the consistency is uniform. They're round. They're smooth. Let's see. Capillary refill is less than 3 seconds. Did I do that on here? Less than 3 seconds. All right. Looks good. So now we're going to move on to your hair. This is where I put my gloves on if I had some. So let's just look through it. Your hair is fine. It's evenly distributed. The color looks good for your age. There's no nits. There's no lesions. All right. And then just looking at your head, it's normal cephalic. It's your facial features are symmetric. All right. And now we're going to move on to your eyes. So by looking at your eyes, your eyebrows are symmetric, your lids are smooth, your sclera is white, your cornea is clear, your conjunctiva is pink, yep. There's no drainage, there's no lesion, everything looks good. And then at this point, I would do the Snellen eye chart with her. That's where she would stand 10 feet away from this eye chart. She would read the smallest font that she could. The 20 on the bottom of the results is what a normal person could see. If she got a 20/20, then she would have perfect vision. And then we would do the Rosenbaum eye chart, and that's where you hold this little piece of paper 14 inches away from your face. Again, she would read the smallest font that she could. Bottom number means what a normal person could see, so if she could read 14 inches away, the smallest font, then she would have 14 out of 14, which is perfect nearsighted vision. All right, and now I'm gonna test your peripheral vision. Where's my pen light? All right. So I'm actually gonna get behind you. And I'm just gonna, if you could just turn this way. Cool. And then I'm gonna go like this. Every single time that you start seeing my fingers, say C or something. Okay. All right. C. 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 All right. So that looks good. Now we're gonna check your extraocular muscles. So you're just gonna follow my pen, all right? All right, and those look intact. And now we're gonna test your pupillary reflex. So just look straight ahead, and I'm gonna shine a light into one of your eyes. So just be prepared. All right, and we're gonna do the other side. All right, so I kind of saw constriction in both eyes when I did that. And now we're actually gonna test your accommodation. So if you could stare at the fire alarm, and then right when I put something in front of you, so that this pen line right in front of your face, I want you to automatically switch your view to the pen line. Stare at the fire alarm. All right, and so I saw constriction when that happened. So I would document in my findings Perla. All right, so now we would move on to her ears. So I'd have gloves on, and I'd be palpating the pinna, and then the tragus right here, and then the mastoid process. And they look symmetrical. And then I'm gonna do the whisper test on her. So I'm actually gonna stand behind you. I'm gonna whisper 3 things into each ear, and you just repeat what I said for both, okay? So for this one, I'm gonna do first, all right? I have to stand a little bit, but okay. All right, so.
Blue car sock.
All right, good job. Okay, we'll do this one.
Bear pillow bed.
Good job. All right. So now we're gonna palpate your nose and your sinuses. I would also have my gloves on still for this. So, tell me, is there any tenderness? No? All right. Looks symmetric. She says there's no tenderness. Good. Then I would take my pen light and I'd actually look up her nose. Make sure her septum is midline. There's no polyps. There's no redness. Everything looks good. And then if you could you hold one nostril and sniff? Okay, and do that for the other. All right, her nostrils are patent. So now I'm going to move on to her mouth area. So just by looking at her lips, they're pink and they're moist. And then could you open up your mouth for me? Her tongue is pink, moist, and smooth. Her teeth are intact. Her gums are pink and moist. Her mucous membranes are pink and moist. And then can you say ah for me?
Ah.
All right, her uvula is midline and rises with phonation. Her oropharynx is pink. Her tonsils are present. There's no redness. Her hard and soft palate are intact. Everything looks good there. All right, and so now we're gonna actually move down to her neck. This is when I'm gonna palpate your cervical lymph nodes. All right, is there any tenderness? All right. And that's when I would check for lymphadenopathy. Lymphadenopathy, that's it. And I would see that her trachea is midline, so everything looks good there. So now do you have a sports bra on?
No.
You don't?
No.
Okay, well, no, it's fine. You know what, we'll just let her leave her shirt on for this. But we're gonna just look at your chest. You can stand right here. Just sit down. Just by looking at her chest, it is symmetric. There's you don't like breathe with any lifts or heaves or anything like that. And then your transverse diameter is a 1:2 ratio. All right. And so now this is when I would actually auscultate your lungs. So I would use the diaphragm for this. And before I do that, I'm actually going to count your breaths so you can just breathe normally. I would watch your chest for 30 seconds, then I'd multiply that by 2. All right, it's been 30 seconds and it was regular. I didn't see any unlabored breathing. All right, and then now this is when I would auscultate her lungs. I would do 6 points on her front, 2 on her side, and then 8 on her back. All right. And since she has to keep her shirt on, I'll do the best I can. All right. Open to your back. All right, so I didn't hear any murmurs and I didn't hear any auscultations. And if I did that in real life, obviously I wouldn't have them keep their shirt on because the shirt can be making sounds that could actually disrupt me listening to her lungs. All right, so now we're gonna do the heart checkup and your cardiovascular checkup. So if you could lay down right here. Cool, so I'm gonna check your jugular vein for distension first. All right. So no distension, your precordium looks even. There's no hip lifts, no heaves, no pulsations. All right, now I'm gonna take your radial pulse. So I would just use these 2 fingers and I would count for 30 seconds and I times it by 2. All right, it's been 30 seconds and your radial pulse was, the rhythm was regular and it was 2+. Now I'm actually gonna palpate all of her pulses. So first I would do the carotid and the brachial right here. And then we already did her radial. Then we do the femoral, which is right here. Oh yeah, femoral's right there. Popliteal right there. Then we do the posterior tibial, which is right here on the side of her foot, which you can't really see, right there. And then the dorsalis pedis, which is right there. All right, and all those were regular and those were 2+. So now I would actually find her suprasternal notch and her angle volui, which is right here, which is then her second intercostal space would be right there. And that's where I know to start listening to her heart. Again, she has to keep her shirt on. So in practice, I would have them take their shirt off, but since she doesn't have a sports bra, I can't do that. But I will show you the areas that I would. All right. Start right here with the aortic. And that's where S2 would be bigger than S1. Then we do the pulmonic, S2 is bigger than S1. And Erb's point, S2 is equal to S1. Then tricuspid, S1 is greater than S2. And then mitral, S1 is greater than S2. Then I would stay here for 60 seconds and I would count her heartbeats. And this is the apical pulse. All right, it's been 60 seconds and her rhythm was regular. Then I would switch my stethoscope to the bell side. That's where I listen to any bruits or any murmurs. All right. All right, everything sounds good. So now, oh, forgot to listen to the carotid artery. Make sure there's no bruits. I'd use that with the bell side. And then hold your breath for me too. All right, everything good. So now I move down to her abdomen and for this, I'm gonna have you lay flatter like that, yeah, and then I'm gonna put this pillow underneath your knees. Okay, good. And then we're just gonna lift up your shirt a little bit like that. Yeah, looks good. Okay, cool. So just by looking at her abdomen, the contour is flat. There's no pulsations. There's no, the umbilicus is midline. There's no herniations. It's symmetric. And I would actually look at it from down here as well. Everything looks good. All right, now I'm gonna auscultate her bowel sounds. And I'd use a diaphragm for this part. All right, and I'm gonna start in the right lower quadrant. All right, so I document that as normal active ×4. And now I'm gonna listen to her arteries for any bruits. So we switch back to the bell. Yeah. So the aorta artery, the renal, the iliac. All right, so there's no bruits. So now I'm gonna palpate her abdomen and let me know if there's any tenderness. I'm looking for any masses. Any tenderness? Feels good? Okay. And then she has no distension, no bladder distension. All right, so now if you want, you can sit back up for me. And we're gonna do the musculoskeletal checkup now. So first, I'm gonna have you stand up and walk there to here. All right, and you can sit back down. And just by watching her, I can tell that her gait is smooth, it's effortless, it's rhythmic. She's well coordinated, she has a well balance, her posture is erect. All right, and now if you could stand up for me, and you could bend down all the way and touch your toes. All right, so she has no sign of scoliosis. She can stand back up. So now we're gonna do some active range of motion, and I'm gonna lead you through it, but also I'm gonna be palpating your joints while we do this. So first, we're gonna start with your neck. I want you to flex it like that, and then extend, so bring it up. And then you wanna just twist it side to side. And then you wanna lateral bend it, so that means ear to shoulder like that. All right, good. So now we're gonna do the same thing with your back, but all you're gonna do is just go forward and up. Forward and up, good. And then you're gonna twist again, good. And then you're gonna bend again. All right, good. So now we're gonna do your shoulder. So we're gonna extend. And then, oh wait, no, this is flex actually. Then we're gonna extend, then we're gonna hyperextend. And then we're going to, right to your side. We're gonna abduct, and then adduct, and then circumduct, so do a circle on your, yeah. And then we're gonna do internal rotation, so put it up there, and then external rotation, so put it down there. All right, good. So now we're gonna do your elbow. So right here, so we're gonna flex, and then extend. And then you're gonna do supination, so put your hand down, and then pronation, put it up. All right, good. So now we're gonna do your wrist, so you're gonna flex, and then extend, hyperextend. And then you're gonna do ulnar and radial deviation, so you're just gonna go like that. All right, good job. And then with your fingers, you're gonna flex, extend, hyperextend, and then you're gonna adduct, so spread them apart, and then adduct, put them together. And then opposition, go like this. All right, good. So now we're gonna do your knee. So all you're gonna do is do a squat for me. All right, good job. And now we're gonna do your hip. So I'll keep my hand right there. You're going to flex, extend, and then hyperextend, bring it back behind you. Yeah, and then we're gonna do abduct, so bring it to the side. And then adduct, put it back to you. Yeah. And then we're gonna do internal rotation like that, and then external rotation. All right, good. And now we're gonna do your ankles. Let's see. So could you sit up here for me? Mm-hmm. All right. In theory, we would have a bigger table for her to sit up at so that I could actually assess her ankles, but I'll just hold it like this. Let's see. All right, cool. So you're gonna dorsiflex, so that means put your foot up like that, and then plantar flex, you're gonna put it down. All right, good. And then inversion, you're gonna go like this with your foot. Yep, and then exversion, or eversion, you're gonna go like that. Good. And then with your toes, you're gonna flex, you're gonna go like this with your toes, and then extend, and then abduct, so spread them apart, and then adduct to put them back together. All right, perfect. All right, and now, now that I have you sitting here, I'm just gonna palpate your muscles, make sure your tone is symmetric, and same size and everything, looks good. And now I'm gonna have you squeeze my fingers. All right, and then I'm gonna have you push up against my fingers, and then I'm gonna have you pull my hands. And then I want you to push up against my hands, and then I want you to pull back. All right, so that was a 5 out of 5. Now we're gonna do the neurological test on you. So we'll just have you sit here. So could you give me your full name?
Ashley Fortney.
Do you know where you are?
Yes, Chapel Hill, North Carolina.
Okay.
My house.
Okay, good. And then do you know what day it is?
It is April.
Well, just like the weekday.
Oh, the weekday? It's Saturday.
Saturday? Okay, good job. All right, so now we're gonna do the Romberg test. So you can stand up, you can close your eyes. For 20 seconds, I'd have her stand here, and I would just be like this to make sure she doesn't fall. All right, you can sit back down, spend 20 seconds. She was well coordinated, she was well balanced, so she's good. and then if you could close your eyes for me and tell me when, we're gonna test your senses, tell me when you can feel this, okay? So just close your eyes.
I can feel it.
Or on my, just say like I every single time you can feel it.
Okay,
Okay. So now we're gonna use the sharp point.
Okay.
And tell me when you can feel this, okay? All right, and now you're gonna tell me the difference between this is dull and this is sharp. So when you feel dull, say dull. When you feel sharp, say sharp.
Yeah.
All right, ready?
Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull.
Okay. Good job. And now we're actually gonna test your reflexes. And I would test it with a hammer, but I do not have a hammer, so I'm just gonna go through them with her. So right here is her triceps reflex. Be right here. This is her biceps reflex. This is her brachioradialis reflex. And then we have her quadriceps, and then we have her Achilles, and then we have her plantar, which is on the bottom of her foot. All right. And now I'm gonna teach the breast examination. All you have to do is listen, and I'm just gonna show you these different diagrams. All right. So for breast examination, you know what? I'm gonna stand up. Move this back. Yeah, you can go back to the bed. So we have it better. All right. All right. So for the breast examination, what you want to do, you want to be doing this weekly or monthly, actually, and then you want to have a clinical examination at least once a year because we want to catch breast cancer at an early stage and so it's not fatal. So what you can do is you can stand in front of the mirror, put your hands on your head, you can lean forward, you're just checking to make sure everything's symmetric. The color is normal, the texture is normal, there's no abnormalities, no irregular masses or anything like that. And then to actually palpate the breast and check for breast cancer, you'd want to start in the inner quadrant, so right here. And so I'm just going to show the camera. So you want to start in the inner quadrant, you want to palpate bilaterally in a circular motion, and then you want to focus on the talus spencer mainly, which is these outer areas. These outer areas, this is where there are the most abnormalities. You want to make sure there's no tenderness, there's no masses. And then also when you're inspecting, you want to make sure there's no dimpling, there's no skin retraction. And then you also want to palpate the axillary lymph nodes, which is going to be right there. Making sure they're not super tender, they're mobile, they're round, you know. All right. So now we're going to move on to the male, or the female genitalia system. So how I would inspect this is at first I would start with the skin and I would make sure there's no lesions, there's no nits. Then I would actually look at the labia majora, the minora, and the clitoris. I could spread them apart. I'd make sure they're symmetric, there's no redness, there's no swelling. Then I would go to the urethra and the vagina, making sure there's no abnormal discharge, there's no swelling, no redness, no lesions. Then we go down to the rectum and the anus. No swelling, no redness, no lesions, no fissures, no hemorrhoids. And then I'd actually palpate the femoral lymph nodes, which are up there. Looking for, tenderness. Make sure they're mobile. All right, now to the male. So for the male, I would look at the skin first, and I'd make sure there's no lesions and there's no nits. Then I would look at the shaft and the urethral meatus and the glands, making sure that there's no redness, there's no unusual discharge, there's no ulcerations, there's no lesions. Then you look at the scrotum and the testes, making sure there's no lesions again, make sure they're symmetric, there's no masses, there's no tenderness. Then I lift them up, look at the rectum and the anus, making sure there's no swelling, no redness, no lesions, no hemorrhoids, no fissures. And then afterwards, I would teach them about the self-examination. And so that's when you want to do that in the shower. And You could do this bilaterally by feeling the balls at the same time, or the testes. And you would want to do this in a circular motion. You would want to make sure that there's no masses, there's no tenderness. And if there is, then you need to tell your physician right away. And then also you want to be doing this monthly just so that you can, detect abnormalities at a early stage, just so that they don't become fatal. All right. And so then I would document all my findings with my patient. And do you have any questions for me, Miss Courtney?
I don't.
You don't? All right. Well, thank you so much for your time, and cool.
Thanks.